Partnership is about connecting, really, connecting all the skills and the resources of the university with all the skills and the people of the NHS and the Health Board, because both are integral, really, in making change, improving patient care. We've got to be able to do things in a scientific way, we've got to do things in a way that can be evaluated properly, we've got to bring new technologies in, new ideas, new ways of working, and it involves both of those groups. Academics traditionally not in the front line, clinicians are, and we need to combine both of those groups. So that's what this is about. It's about connection, it's about partnership. It's gone really well today, really pleased. It's evident that there's a real appetite for a bit of change, for doing things a bit quicker, for patient safety, progress in healthcare, doing things slightly differently. We all know it has to be done slightly differently. And I got the sense today there was a bit of an appetite for doing that. It's been really positive, lots of people interested, lots of people offering to help, lots of people want to get involved, which I think is a great sign that we can change culture, move things forward, release people to do some of these things that need to be done. We've got a really eclectic, diverse group of people, really. We've got clinicians, we've got academics, we've got people who are experts in IP, we've got people who are experts in medical device development, people who have been there and done it themselves in terms of invention, business people, engineering people, real different group. And the idea is if they don't know the answer, they will know somebody who does. So that's the way it's been working. A lot of really good ideas probably lie fallow because of that people are put off by the process, don't know where to go. So the idea of having this centre, innovation centre, is that people will be able to walk through the front door, with very simple ideas often, but be able to get the help in the other areas in which they're not so strong in order to take it forward and, essentially transfer it into patient care as soon as possible rather than taking years.
Well, I guess what today marks is it's a bit of a milestone about recognising that this is now a different relationship. I think moving to a number of different expectations about the pace of change that needs to occur, the way that the organisations are going to work in support of each other, achieving funding streams. But I guess the most important thing is to support creative thinking from staff right across both of those particular sectors. If innovation isn't about making a difference for patients and doing that quickly and bringing in new technologies and practices, I don't really know what it's about. There's something about allowing ourselves to challenge the system that we have. I think we should be very proud of what the NHS offers to our communities and to our population, but actually we're also allowed to change the way in which we deliver it in order to get the best outcomes for our patients. So what I would ask people to do is to really grab innovation, be creative, but it's okay to be quite radical in the way in which we organise ourselves for the future on individual services. I think what we're trying to do through these types of approaches is make sure that we can get behind staff at the front line, probably reflecting on their own frustrations or the way that things that work, that do have an idea, but perhaps they just simply don't have the time to sort of pause away from the busy day job to do something about it. And I think it's about giving very quick access to people for those, often very simple ideas and actually converting them into something that matters. We've got a responsibility to make changes that help patients, and I think that's what the purpose of this is through this partnership venture.